find the disease to actually manifest as a heart attack. Now what happens is, because all these factors like smoking, alcoholism, stress, advancing age, genetic factors, pollution, and all these factors, what happens is there is a gradual buildup of fatty streak inside the artery. Now the artery has got three structures. It's called intima, media, and adventitia. Now this streak starts building in the medial layer of the artery. So there is gradual buildup of plaque inside the artery, which gradually extends and narrows down the artery. Now this process of deposition of cholesterol and fatty streaks and lipid peroxidation products, all this in the medial layer of the coronary artery that I was talking, that causes carries blood to the heart, there is a gradual narrowing of this lumen of the artery. Now what happens by time there is gradual increase in this fatty streak, that gradually decreases the lumen up to 80 to 90% of the artery. Then imagine the amount of blood supply that is traveling to the heart is traveling only via the 10% of the patent artery. 10% of the patent vessel is only supplying the whole of the heart. Now what happens at age 50, 55, 60, 65, because of this gradual accumulation of fatty layer and plaque that approaches the muscle wall and the intima, the innermost layer of the blood vessel. Now just imagine if that part of the vessel immediately breaks off, that nips. So this fatty streak goes ahead in the arteries and it causes total occlusion of this artery. That causes acute loss in blood supply to that part of the heart. Now this in medical terms is called necrosis, or what we call in normal term is there is death of that part of the heart that is receiving blood supply from that artery. So this is what we call it as an infarct. And if it happens in the myocardium is that heart muscle in the heart, the middle layer of the heart is called myocardium and the muscle. And now if that part of the muscle does not receive blood supply because of this rupture of this plaque that goes and lodges distally in the artery, that causes immediate shut or immediate closure of the gates of blood supply that reaches this muscle. So this is called as a myocardial infarction, or in layman terms we call it as a heart attack.